Congratulations! So, let's start our Invisalign journey together. So, first off, you feel the bumps on your teeth now. These are called attachments, and these help the teeth move more efficiently.
Smile. Here are a few tips that will help you along the way. Remember to clean your aligners before wearing them. Wash your hands with soap and water and handle only one aligner at a time. Clean both the inside and the outside of each aligner. Each aligner is marked with a U or an L for upper and lower, followed by the stage number. To insert your aligner, gently push it over your front teeth and then use your fingertips to apply gentle pressure over your molars until the aligner snaps into place. Remember, your aligners only work if they're in your mouth, so wearing them consistently will keep your treatment moving forward. Since the aligners are virtually invisible, no one needs to know you're straightening your teeth. And you can drink cool water while wearing them. If you're eating or drinking anything other than water, you'll need to remove your aligners to protect them from damage. It's also a great opportunity for good oral hygiene.
Every time you change your new aligner, there will be some pressure. And it means that it's effective. However, the trick is to change it right before you sleep so that you can sleep through it while dreaming about your new smile.
Ideally, you should brush or floss after every meal or snack, but if you don't have a toothbrush with you, rinse your mouth and clean your aligners by holding them under warm running water. Always store your aligners in a case to prevent loss and damage.
Please make sure that your aligners are in perfect fit before you change to your next set of aligners. You could change your aligners weekly unless differently prescribed by your dentist. One tip is to download Tray Minder app, which will be able to track your progress as well as to take some selfies to know your new smile as it changes. After you proceed to the next aligner, put back your old aligners into the Ziploc bag so that it can be used as a backup.
Enjoy food with friends. Take photos with confidence. Invisalign doesn't interfere with your social life the way braces can. Aligner removal is simple. Use your fingertip on the inside of your back molar to slowly pull the aligner from your teeth. Repeat on the other side, then remove the aligner. Let your doctor know if you have difficulty removing your aligners. When starting a new set of aligners, switch to your new set in the evening. Rinse the new aligners and wear them for at least 12 hours straight. If you feel discomfort, ask your doctor if you should take an over-the-counter pain reliever. New aligner discomfort generally subsides in a few days.
Watch this video a few times and follow these simple guidelines to improve your Invisalign experience and comfort.
Hey guys, so we're live. A very good evening to all of you here. Okay, so I hope you guys have had your dinner. So we're going to be having a very insightful topic today, which is about aligners, and we'll be calling over Dr. Beh shortly. So let's chat for a bit till we invite Dr. Beh. Have you guys eaten your dinner, and do you guys brush your teeth after every meal, or do you guys just brush your teeth once a day or just twice a day, not after every meal? And if if you brush your teeth, what toothpaste do you prefer and which is the best? We'll discuss every other thing about your dental hygiene and how to perfect your smile, what you should do in a while. So I'll be calling over Dr. Beh. Let me just introduce you who is Dr. Beh and who we'll be talking to in a while. So Dr. Beh is a dental surgeon. He's from iCare Dental. He is a dental aesthetic surgeon who has been doing a lot of things such as replacing missing teeth. He's been dealing with teeth straightening procedures, also smile makeovers with digital smile devices. So Dr. Beh was one of the top overall students in the year 2010, and he continued to obtain his fellowship title from Asia Pacific Academy of Implant Dentistry. Dr. Beh is also the president of Malaysian Oral Implantology Association, also a member of Malaysian Dental Association, and a treasurer of Malaysian Association of Aesthetic Dentistry. So let us now welcome Dr. Beh on the screen.
Hello.
Hi, Dr.
Hello,
Beh.
Amita.
How are
How are
you?
Good, good.
Have you
had
had your dinner?
Yes, yes, definitely.
It's so
Yes,
nice to see you.
yeah,
So today we're going to be talking about how you're going to transform your smile with how we can transform our smile with Invisalign, and
yeah.
maybe you can give us an insight about what exactly is an Invisalign and just give us an introduction about it.
All right. So today we will teach a little bit on transform your smile with Invisalign, right? So I do have some slides prepared, and I think it's pretty cool that we will. So just to introduce myself again, I'm Dr. Beh. I'm the co-founder and director of iCare Dental. I'm also a founder of Face Dental Concept, which I will explain to you all later. So before we start, let's start with something light, So the next picture is just an icebreaker. So with this picture,
Okay.
all right, what something's wrong with this
Well, I
picture.
can definitely see there is a missing teeth there, which is very
All right,
obvious.
on the guy, right?
Yeah,
On the
on the
man.
guy.
So, but do you realize that actually the eyebrow is also gone?
Oh God. Okay. Yeah. Even his eyebrows is not there. I did not see that.
Yeah. Yes, and really, this pictures actually just show the importance of our teeth, right? Because if you have a missing tooth and you're missing eyebrow, people will actually notice your teeth first, and that's how important our teeth are,
Teeth is,
right?
yeah.
So because of that, I'm sure that all of us wants to have our dream smile, right?
Yes, definitely.
Okay. So in your opinion, Navinder, what
Mhm.
is what is a dream
What is a
smile?
dream
What's the
smile?
perfect-
Okay, for me, probably a straight, nice, white teeth, aligned teeth. That would be perfect for me, I think, as a person. Yeah.
Yep. So you think that is as long as straight, is very wide, and that's it, right?
Yeah, I think that's decent enough.
Okay. So if I give you this teeth, are you happy with this teeth? Yeah. If I'm ever gonna give you very very wide teeth, perfectly well aligned, the anatomy is correct, everything. Is
This
this
would be perfect. Yes, this would be
this will be
perfect.
all right? So this is what I would say the general public would think of a perfect teeth. But let me tell you all that dentists actually look at teeth a little bit different. What we want to achieve is not this, but what we want to achieve is this.
Oh, okay. This looks pretty much more natural, I think. Yeah.
Exactly, exactly. And
Mm,
what I think nowadays the trend is going towards more natural
natural
look.
looking. Yeah.
And the most important part, just now I talked about face standard concept. And when we
Mm.
talk about natural look, we want our teeth to harmonize with our face.
Okay.
Yeah.
Okay.
So it matches your face. So it's not
Yeah,
like
so it suits your face. It doesn't look weird, right?
yes, exactly.
Yeah.
You do not need to shine out. You need to look pleasant. You need to look nice. Everything is tidy, but you do not want it to look like the previous picture. Actually, like
Yeah. I think
solid
this
white.
takes over your whole features. It just people just notice your teeth and not other features of your face if it's too striking, right?
And most people will just definitely know that hey, you have done something to your teeth, lah,
Yeah,
basically.
yeah.
Right. Yeah. So and that's why now aesthetic, those aesthetic medicine and whatnot, they are getting better and better in doing less invasive procedures.
Okay.
Yeah. So we're going to go for less invasive procedures, and we are doing so as well with Invisalign.
Invisalign, okay. So
Yeah.
Invisalign is basically non-invasive, and um, how is the pain tolerance like? Is it very painful compared to braces? What do you think?
Okay. So I always explain to my patient like this: when braces, every time you come, right, you need to tighten it for the next 4 to 8 weeks or 6 weeks usually. So one and 1.5 months, and that's the
Okay.
tightness I need to do. And for Invisalign, we actually do it weekly. At home, we will give you a set of trays, and let me explain to you about Invisalign. So Invisalign is actually a clear aligner treatment that uses a series of orthodontic device and make of transparent plastic to move our teeth. So, for example, your teeth is on the right and left, and you want to move it together, right? So the first plastic tray is like this. The second one comes closer, 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 closer. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Every time you change, every week when you change, the teeth actually move better and better and better. That's how
Okay,
Invisalign
okay.
works. Yeah.
Very interesting.
So
Okay,
that's why it's less painful.
okay, so it's less painful. And what are the age range like? Can anyone use Invisalign, or is this that adults? Will it be advisable for children as well?
It will be so the Invisalign is quite a comprehensive treatment. For adults, definitely not a problem. I even have 80 plus years old starting to do Invisalign. Really. And actually yesterday I have two patients that are in the 60s, and they were saying that I did for their friend, and they started saying, hey, since it's not so invasive, I don't need to look let everyone see that I'm wearing braces. I just need to wear this transparent thing that people do not know, and they just look good
Yes.
after that. Yeah.
I think that would
And
be the best these days, as people
yeah.
want to just continue their day-to-day life and still not have something
Mhm.
visible on their tooth, especially if they are going out meeting people and trying to socialize and stuff like that, right?
And also we have already launched in Malaysia, I think beginning of this year, Invisalign Kits, where we actually start to correct the malocclusion, the bad bite, since very young. So that's called phase one. So before because their teeth are not formed fully yet. So when they are kids, right, sometimes, let's say, I will explain later, sometimes your jaw can be very outwards, and you can actually use Invisalign first to correct it first, and then continue the growth until you are well developed with all your permanent teeth. Then we start with full Invisalign after that.
Okay, Dr. Beh, I just have a question for you. I can't see any comments. Can you see the comments?
Nope.
I can't see as well. I can't see any audience commenting. I would love to know if anyone is there. Is there something I should
Yeah,
click
I saw
on?
the comments. There are a lot of comments.
Oh,
Hi,
okay.
Doc.
Where is it?
Okay, it's at the chat, the lower screen. There's a chat, right? The fourth button is chat.
Okay, chat. Okay, chat. Okay.
Chat and then comments. How to fix overbite.
Okay.
Any suggestion to fix overbite without braces? So thank you
we
very
have
much
some
for
questions.
asking.
Yeah.
Yes. So without braces is Invisalign. So Invisalign is one of the way where we can actually treat a multitude of treatment. In fact, I will show you some cases later on, and also teach you how to diagnose yourself a little. What about that?
Okay, that'll be interesting. I am waiting to actually hear your thoughts and teaching on this. Before that, you guys, we are going to be giving away something really interesting. So please stay and pay attention on what Dr. Beh is going to present in a while, because he's going to be giving away a free giveaway on his teleconsultation. So let's pay attention on what he's going to say, and I definitely think it's going to be very interesting. Yeah, let's go, Dr. Beh.
All right. So Invisalign is the forefront of clear aligners, and they are the first in the world. All right, and they have done so far 10 million cases. Can you imagine 10 million cases? And they do it actually collecting all the data of how teeth move. And with these 10 million patients, they actually rewrite their algorithm, making sure that Invisalign works. By the way, I started Invisalign around 7 or 8 years ago, and those days I do very little cases because I feel that the teeth doesn't move as predicted.
Okay.
But as I've used it so many years, and I am more comfortable with the advancement of Invisalign.
You mastered it, and now that's why, guys,
Yes.
Dr. Beh is also known as the legend, as he has been such a professional in what he does. So it's amazing. Yeah.
Yeah. So actually, it's not me. It's also the tool that Invisalign actually is a tool where he uses a 3D scan. So this is called intraoral scan, where we take a picture. It's like panorama of on your phone, but it's in the mouth, and we move it. And so that have you taken mold in the dental clinic before? Have you ever taken a mold, like a rubberish thing where they put inside your mouth?
Oh yes.
All right.
Is it the one while they put the rubber while just to open up your mouth?
No. There's one more that when they take a mold, they take an impression, they call it.
Oh, okay. I think I've not done that, but I've seen that. Is it like it's like a plasticine kind of thing?
Yes, exactly.
Right. Okay.
So what people find that is very gross, first of all. Secondly, it is so very uncomfortable because it presses all around and touches your palate. So some people will feel gagging and all this. So now actually there is something called a 3D scan. This is called an intraoral camera, where we take a picture of your teeth step by step, and we're actually able to get a 3D image of your teeth.
Okay.
And Invisalign does a step further. It plans to straighten your teeth with this 3D image. So this is actually it's technology. It's a tool. So with this 3D scan, we are able to do from like on the picture on the left, a little bit crooked, and how we moved it digitally to get straight teeth. And that's the beauty of it. Before you start Invisalign, we can actually know the end.
How it would look like.
How will it look like? So some people just like to ask me, what is your dream smile? A lot of people cannot imagine their own teeth even. First, you can imagine your own teeth, and then after that, you get the final one before you even start. How cool is that?
It means that you can see yourself at the end of the result, how it would look like, right?
Yes. It stimulates.
Wow.
So there's a stimulation that actually show how you actually look after. And I'll show you some cases later. Yeah.
Okay.
But reminder, Invisalign is only a tool. And in the hand of the master, an umbrella can become a dangerous weapon. It's just like Wong Fei Hong like that. An umbrella is an umbrella, right? But it's how you use this umbrella.
How you use it, yes.
Yes. So Invisalign is a tool, but in the hands of masters, even umbrella can be a very, very dangerous weapon. Yeah. So thank you, Invisalign. Just openly thank Invisalign, Invisalign Malaysia as well. By the way, Invisalign from US main company, and they have awarded us with diamond status for Invisalign provider last year, and as well as most likely this year. So every year they haven't awarded this year.
Congratulations! That's amazing.
Yes, and only in Malaysia there are only 3 groups that has been awarded this award. So we are the top 3 in Malaysia that was awarded, and I'm very honored and privileged to receive this badge by Invisalign. And I'm also very honored that they engaged me. I'm also teaching, all right? So I actually teach younger dentists to do Invisalign in my clinic, as well as I do teach other dentists to become certified in Invisalign and how to use Invisalign to give the best treatment for our patient. So I have more than 10 years of clinical experience in orthodontic general practice, and I've done more than 1,000 patients.
That is why you're called the legend. I could really agree to that.
No. After you see the cases, then you'll be more interesting. So just reminder, right?
Yeah.
Later on at the end, there will be a giveaway quiz, and I will be giving 3 free consultations for those who answer with the most.
The question. So I'll be also checking the comments every now and then. Okay, so there is a question about how much is the braces, the silicone braces. There is also a question if that is it can be done by older adults. Can this procedure be done by older adults?
Yes, this procedure can be done with older adults. That's why I shared. There's one patient that is 80 plus years old, and she decided to even carry on because she finds that she don't like food getting stuck in the front. So Invisalign can be a very, very complex, can treat very complex case, and also it can treat very, very simple case. And the beauty about Invisalign is this: it can treat each tooth one at a time. Let's say, for example, you don't like your front teeth only. I can do only the front teeth.
Okay, so you don't need to disturb the bottom teeth. It's just the front. Yeah, that's amazing. Okay.
Yeah. So let's say you don't like the front 2 teeth. Yeah, I just adjust that 2 front teeth. That's why I leave it.
Okay.
Yeah.
That's very specific thing that you can actually adjust. I think it's very interesting. Yeah. So guys, please don't forget that we have a giveaway. So let's pay attention and let's keep engaging. So comment your answers on the comment section below. And whatever Dr. Beh is going to explain now, keep in mind the quiz is going to be based on this. So yeah, just a tip. Okay, let's go, Dr. Beh.
Yep. So just now you talked about pricing as well. You all can check out the Invisalign package by Dr. On Call in the link after.
Yeah, there will be a link. Yeah, so you can click the link and you can either get a consultation or check out the price and the package ranges. So yeah.
Yep. All right. So, but before we continue, we have a special guest with us today.
Okay, yeah. Someone that's going to share their journey with their Invisalign. So, should we welcome Tiffany?
Hi, Tiffany.
Hi.
Hi,
Hi guys.
Tiffany. How are you?
I'm great. How are
Have
you
you had
guys?
your dinner?
Yeah.
Yep.
Okay,
So,
so
so Tiffany has been wearing Invisalign for a year plus since 2019, and so there will not be only from a doctor's point of view. We will also have a patient's point of view. So
yes.
can be more. If you ask the question just now, is it painful? Probably, Tiffany, your answer. How do you feel? Is it really painful? Or
Yeah,
how do you
Tiffany,
So
share with us your journey. How was
so
it?
when I first started getting Invisalign, I was very prepared for my teeth to hurt. I was expecting it to hurt, but kind of to my disappointment, it really didn't hurt that much. On like a scale of
Sorry,
1
can
to
I just
10.
know, was your case
sadist? Are you sadist that you want to get
Because
painful?
because I have a lot of
Tiffany,
friends who. Huh?
can I just know, was your case a severe one or a mild one?
So I had an overjet, like Dr. Beige, like that overjet. I think he should explain like what is an overjet.
Okay.
Overjet is basically your upper teeth is much more in front than your
Yeah.
lower teeth.
Okay,
Yeah.
okay.
Yeah,
So
so
how
it's
long
like
did
kind
you roughly solve that?
I'm still using Invisalign actually. Like I have like this box here, see? So this is my second treatment because my first treatment I should end like last year, but then I wasn't satisfied with the results, so I requested for a second treatment. So I'll be using it now until next year.
Mhm.
Okay, that's pretty much
Yeah.
great. Okay. Okay. So
Okay, so
should we continue? Yeah.
yeah, let's continue. So Invisalign sometimes is called refinement, where just like we said that the good thing about Invisalign is this: after we arrange from the pre-planning from before to after, and after that, sometimes certain teeth are a little bit the gear, and there's one listen, and yeah, that happens. And what we do is we scan and send to Invisalign again, and then we are able to correct it. That's as simple as that.
So there's no case that can't be solved. Even if it can't be solved, you can still do it again and scan again and make sure that all tooth is properly aligned, right?
No, I would disagree on that though. I would say Invisalign is a very versatile tool that in the hand of master just now, it can solve a lot of cases. But it doesn't
Okay.
mean that it is like a golden bullet that can treat all kind of cases.
Okay.
I must be fair to braces. I do a lot of braces as well, by the way. So I do a lot of braces, I do a lot of Invisalign, I do a lot of implants, veneers and whatnot. But to be fair, braces has its strength and Invisalign has its strength. And in some case, I would say better do Invisalign lah. Some case I say better do Invisalign. But
Okay. Okay.
the more I invest time to learn about Invisalign, I realize that Invisalign is so much more effective in some cases. That some dentists will say, "Oh no, your case to do Invisalign are very difficult." But when you master it, I'll show you some case later. As I said, I'm sure you are still waiting. Just now when we saying like that,
Okay.
I'll show you some real case right after this. About the cases that I've done and how we actually use face dental concept in Invisalign.
So guys, if you're interested to get your Invisalign journey, it's best you get a consultation with Dr. Beh to know exactly what you should do and what's the best for you, right, Dr. Beh? Yeah. So you can get the
Yeah.
teleconsultations from the link below on Dr. On Call. So go check the link out as we discuss further.
Yep.
Yeah.
So, as I promise you, I will also teach you all a little bit on dentistry. Yeah. So all of you all become a small dentist among your friends and whatnot first. Of course, I'm sure you all know the two terms that you all need to learn. First is called crowding, is spacing. Crowding, it means that your teeth are just very messy. There's not enough space. So it's crowded.
Okay.
So it's crowding and spacing.
Spacing.
Right.
Spacing,
Simple.
there's space in between, right?
Yeah, spaces in between. All right.
Okay.
So that's the two most common complaints or problems your teeth. The other two things that you all should know just now is, but Tiffany just now said also, something is called overjet. Overjet means your upper teeth is much more forward than your lower teeth.
Okay.
So that everyone has overjet. So by right, it should be 1 to 3 mm. That's ideal.
I agree.
So anything more than that, it is extra overjet. Then there's something called reverse overjet, means that the lower teeth is in front of the upper teeth.
Okay, yeah. Yeah, I think I've seen
Okay,
certain cases of that. Yeah.
Yeah. And then the second thing you want to learn, just now someone comment about overbite. Overbite means like that. Normally, our upper teeth and lower teeth just joins and cover the tooth around 1 to 3 mm as well, or 1/3 of the teeth. And overbite means that it actually bite more than it's supposed to be. Become a
Okay.
deep
So
bite.
can Invisalign help overbite cases?
Yes, definitely. Overbite is magical in Invisalign. And
Okay.
one more kind of bite is like that. So just now, as normal bite, if down is called deep bite.
Okay.
And if it's up, it's called open bite
Okay. Open bite. Okay. Okay.
and deep
Okay.
bite. Yeah, but you all don't need to memorize this. Today, I want to teach you all some part, a little bit of self-examination, because a lot of patients do not know their face, and they actually rely too much sometimes on what their friends say, or even some doctors say, and a lot of opinions. So I want to teach a little bit on face and the concept that our teeth actually affects our face. So we're going to do something called 1 plus 1. All right.
Okay.
So it's a self-diagnosis by face standard concept. So it's 1 plus 1. So everyone can remember, right? 1 plus 1. It's as simple as that.
Okay.
All right. So let's learn together. Tiffany, you all right?
Yeah.
Yeah.
I'll do it with you.
All right. So the one part, what is the one first? So this is the one that we'll talk about. So just now we said about overjet, right, Tiffany? Remember? So your one, which one do you think? So the picture on the left is called class 1, which is how a normal teeth is supposed to be. Class 2 is increased overjet, where your upper teeth is forward. And class 3 is terbalik. The lower teeth is more forward than the upper. And this is the most common, we call it angles classification of our bite. And Tiffany, how's your teeth last time?
Mine was like class 2, you know. It kind of look like those rabbit, you know, like they have their front teeth. Yeah.
Okay.
Okay. So do you do any extraction on teeth or whatnot?
No, but my dentist say if I use braces, I would have to extract my teeth. But with Invisalign, I don't have to like extract any teeth.
But doctor, how is that possible that with braces you need to extract your tooth, and if without, with Invisalign you don't need to? How is it work?
There are some cases that we can do it with extraction. Sometimes we do not do it extraction. One of the special part of Invisalign is this. They have something called sequential distalizing. It means like that all our teeth is very forward, right? What we do is with Invisalign, we move the back teeth backwards first. Then the next tooth behind. Then one tooth at a time. So it pushes the teeth.
Process.
It's a process, yes. And braces, you can't do that. Braces doesn't have that. That's why in some cases we are able to push it backwards and plan even before we start. So in some cases we can do extraction. Sometimes we don't do extraction. It depends on the face. And as I said just now, the teeth affects the face one. So it depends on the face, how we want to end it. And the good thing about Invisalign is this. We actually can tell whether do we need extraction really or not. Do you know that last time, right, every case when I learned braces 10 years ago, every case the dentist will say, the orthodontist will say, extract, everything also extract.
That's the scariest part.
Yes. But now we are more conservative. We say we want to save teeth. We want to try to manage it. If we are able to do so, we are actually able to save some teeth first. We are able to open up our airway. Actually, do you know that our teeth is anchored to our jaw? Our jaw anchors to our spine, our neck, to our shoulder, to our back. And face standard concept is this. Our teeth affects our bite. Our bite actually affects our spine, our shoulder, our posture, even our back. That's how much dentistry can actually change your life. So it's not just a smile. Yeah. So dentistry is really not.
Friends, who used to be so scared and afraid of getting their teeth done because they have to extract their tooth. So I think this would be the best solution for those of them who always have the fear of removing their teeth and extracting.
Yeah. So there's always every time I do a clean check That means every time I do a plan, I will plan one with extraction, one without extraction, more extraction, or whatever. And we can simulate all the plans and know the end results before we start. So that's the beauty part. Yeah. So anyways, let's come back to our 1 + 1, 1. All right. So this is called class 1, class 2, class 3. And it actually affects sometimes of our structure. So it's not only our teeth that is out the upper or lower, but it's also our bone. And our bone also affects, of course, our face. So what you see on the outside is, of course, the face. You don't look at people's bone, right? You look at other people's face. So on the class 1, your face is usually a bit more flat. Class 2 is you have a sunken lower chin usually, or the upper one is very protruded. That could be Tiffany, or a little bit. Not all. Every patient is different, but class 3, the lower jaw is much more forward. And so, how to diagnose yourself? How do you know you yourself? Are you class 1, class 2, or class 3? So this is called the first one part. The one part is what we call E-line. E-line is a diagnosis or analysis where you can use your finger or you can use a ruler. It's easier to use a ruler to put on your lower chin all the way to your nose, like this. All right? And you can even use your finger, just put at the end here and touch your nose. All right,
So
when you do that,
your lips shouldn't touch that ruler, is it?
yes, exactly. So by right, if this E-line is touching on your upper lips, it means your upper lips is protruding.
Okay.
If it's touching on the lower lips, means the lower lips is protruding. This is one of the analysis. It doesn't mean any. It doesn't tell you everything, but I think this is one of the easiest to know.
The easiest. So you guys can do it at home. I hope you guys are trying.
Yeah.
And there's a few questions, Doctor. Maybe we can answer one or two of them.
Sure.
What is the time frame that is different between the comparison between the conventional braces and aligners, Invisaligns? The time
It depends on cases. It depends on cases, but in my hands, right after this slide, I'll give you one case that makes me myself excited because I only treated her for a short period of time, but I have done amazing results, and I'm really proud to say that she's my patient and this is my case. Should I share with you the case first?
Yeah,
before
let's see that. Let's see that. Okay.
All right.
Wow. Okay.
All right. So she's shaded. I asked her permission to share a picture. Definitely. So now we are looking at this patient. We usually take pictures to make sure that we are also aware of the real part, right? We also have a digital scan to know our teeth. And in this picture, we can see that we use the E-line, yeah? So the E-line is when we hold the lower chin. And in this picture, what do you think? Is the upper lip touching?
Her lower lip is touching the line, right?
The lower lip is touching the line. But actually, the upper lip is also touching the line.
Okay, both of it. But upper lip is like not so much, right?
Not so much. It's covered by the line, but the lower one is much more. So this means that actually this is called bimax. Bimax, it means that the upper and lower also very forward.
Okay.
Yeah. So in this kind of case, so let me click into the clean check. This is the real patient, and this clean check, it means the planning software of Invisalign. So I'm going to show you how I actually work. All right. So when I after I scan everything, what I'll get is a 3D image like this. All right. Of course, I can drop down to see the pictures. I can see the smile and everything. But because of patient confidentiality, I cannot open everything. But definitely, you can see this is the teeth. All right. And if you can see very clearly, the teeth is actually slanted. It means that it's slanted a little. All right. And the most important thing is a little bit jutting out. And with Invisalign, I'm able to extract teeth. I extracted this patient because it's too forward. And we are able to move the whole jaw backwards like this.
Oh, wow.
Yeah.
That's
and
interesting.
There's
So
a lot
this
of buttons.
is without extraction?
No, this is with extraction.
Okay.
So in some cases, we do extraction. Some cases, I don't do extraction. I will show you a case without extraction later on as well.
Okay.
And one very cool thing, this is called superimpose. All right. So let's say this is the blue color is before, and white color is the progress and after. So basically what we do is we will move the upper jaw and lower jaw backwards like this.
Okay.
So
wow.
let's take a view from the top. This is how much the tooth actually moved in. So previously, it's like this. After we extract and we move the whole jaw, and we can see that we can even draw a ruler. I can know that in this patient, I will be able to move approximately 8 mm.
Wow.
8 mm, that's a lot of movement to go inside. Right. And the most beautiful part about this case, so if in normal braces, this kind of case, in my experience, probably I'm not so good, but no, I done a lot of braces, and I would say averagely, this kind of case would probably take 2 years.
2 years.
Is it?
Fair enough. Yeah.
I think it's quite fair, 2 years. And
Yeah.
some, of course, and that's if you use a good braces. That means if you are using self-ligating braces like Damon, American Orthodontics, this kind you can finish faster. If it's traditional, some patients will take 3 years or 4 years. But in this case, I've done it in 6 months.
What? Seriously?
This
This
case
is done
is
in
done
6
in 6 months.
This looks like
And
a
I'll
severe case.
Yes, and by the way, I just saw this patient on Friday. That means yesterday, right? And I decided to put this case inside because it's fresh in my mind. I know every single part of this case. I've done so many cases, I cannot remember all the cases, but this case actually reminds me that
6 months is amazing. I wouldn't have guessed it for 6 months.
this is 6
Definitely
months.
not.
This is 6 months, and it's possible. It's possible.
It's possible.
However, as Tiffany says, sometimes not everything is perfect, right? So I will show you 6 months after, and then we will do refinement. Yeah, so let me go back to the screen. Okay, so this is the face just now, yeah? And before we start, we actually also simulate certain movement, and we actually do a simulation of the before and after. All right, and this is how she looks. So from outside like that, and bring it in. But of course, this is nice. At least you have a picture, like imagination, like, okay, this is how I look. Before outwards, now is inwards a little.
Yeah.
Not too
I
bad,
think
right?
It's so much different. I mean, when you see her smile, because she has a very wide smile, so
Exactly,
it's very obvious. Yeah.
So this one is already this previous picture. This one shows that it's too wide, and after bringing it in, she looks more pleasant. So as our face, we need to plan our
And
teeth.
even the teeth
to
look
face.
smaller, right? Compared to
Yes.
when it was protruding, it looks like really huge.
Yeah. As you bring it in, it looks better, lah.
Yeah.
And I want to show you 6 months result, actual picture, not simulation.
Okay.
Actual picture, 6 months. We are able to close up most of the space. You can see on the pictures, most of the space has been closed after extraction and everything. Of course, if you really are so particular, if you can see, I'm not sure you can see, on the premolar region, which is the middle section here, some of teeth is not touching. That minor part lah. So what I will do is in this patient is that I rescan, take the image again using the panoramic in the mouth, and just settle that back, and probably will take another, I don't know, 3 months or 4 months, and this case is done.
Done.
But
Wow.
just now I talked about E-line, right? Remember the E-line?
Uh-huh.
E-line where we put a finger or the ruler. This is what we get after 6 months.
Wow. Okay, this is perfect. There's
Yes,
no
this is
protruding.
perfect.
Yeah.
Yeah, it's not protruding anymore. When you draw a line from the chin to this one, her upper lips is actually 1 or 2 mm behind the line, which is ideal. And the lower lips is just touching, which is okay. And I'm really, really happy. Not only that, it's not only about the teeth and the chin, by the way. If you can see a little, even the face is slightly lifted up a little.
Oh.
If you let's go back a little, you can see.
Oh
it's
yeah,
good.
yeah, yes.
But when we extract
Her
and move it,
cheekbone looks higher.
yes. When you plan your case very well, dentistry changes your face. It changes everything, and that's
And
how
this is
she
done
looks.
like in less than a year.
6 months, 6 months, not even a year.
Months. Not even a
6
year. Yeah.
months. We only went Invisalign for 6 months. And just now a question to answer just now, if 6 months, this is possible. I'm not saying every case is 6 months,
Yeah.
but in my hands, this kind of case, I take 6 months. Of course, one more thing, a criteria for all my Invisalign patients. First, you must trust in me. Of course, you must trust the doctor. When I tell you it's possible in 6 months, if you trust it, you must take my word. Secondly, I need the cooperation of my patient. Invisalign is about compliance. It means that my patient must listen to how I instruct them. So I give her very specific instructions on how to wear the Invisalign, on how to bite chewies. I even train her how to use her tongue exercise so that it help her to shape her
Shape
face.
her face.
Yeah.
So
So
there's a
face
comment. Someone said that you need to change the new IC picture after that.
yes, probably. Otherwise, you get caught. Like this is not a person. This is not a
This is
person.
not
Huh?
you.
Yes, yes.
Yeah.
And I'm really proud of her. She's been a very, very nice patient. And she listens to every single little thing. And I think yesterday, all we talked about half an hour is instruction, like, doctor, is this okay? Is this okay? Is that okay? And I teach her every single thing to make sure that not only her teeth. When I look at a patient, I don't want to look at her teeth. I want to look at her face. I want to look at her posture. I want to look at her confidence. I want to look at how she smiles. That's what I live for, basically.
I'm
If I
very sure
get,
she feels differently after her changes. She must be really happy, right?
yeah, she's really happy, and even guys sometimes are not so sensitive in all this as in a husband. Previously he said, what can you do in 6 months? Then after that, when she see, whoa, my, really, it really looks way better, really way better. And when you take a picture of before and after, then realize, oh,
It's a
she
lot
might
of
even look
difference.
younger and prettier, really. And it changed her lives, I believe this. And
Okay.
so this 1+1 is called E-line, or short for
Okay.
aesthetic line, basically. So how to look pretty, yeah? So this is 1, self-diagnosis, correct? My face standard concept. Now we go to the second portion, the plus. All right, the plus. The plus is actually not really a plus, but it's actually made up of two things. We call it the horizontal, which is the sideway, and a vertical. So become a plus, right? So the
Yeah.
plus is actually a horizontal line and a vertical line. And that's how I see my patient as well, using face standard concept. By the way, I am also a holder of American Academy of Aesthetic Medicine. This is not dentistry. This is medicine, which means I also do a little bit of Botox fillers, not for myself. For my patients, I can't inject myself. But I do incorporate aesthetic medicine into dentistry as well.
That's
Because
amazing. Okay.
because when I find out that a lot of patients, when you want to do braces, it's not just one straight teeth. You also want to. The main reason is you want to have a good smile and look prettier, right? And look more handsome or pretty, look better. And in order to be more holistic, some of my patients, I would say after braces, you need to put a little bit of filler here, or you need a little bit of Botox here to shrink down your face here. So I incorporated aesthetic medicine into face standard concept and my dentistry.
Wow. Okay. Amazing. This is
But
amazing.
anyways, this is called, so when I look at a patient, right, I don't look at them on their teeth. I need to look them on their face first. So the horizontal line is the horizontal line on the left picture. Basically, there's a curve. So we have this portion here is equivalent to this portion and equivalent to this portion. Tiffany, what do you think? Is this portion, and this portion quite equal?
I feel like my middle part is longer. No, I think so.
The middle part is slightly longer. Yeah. So sometimes not everyone's ideal, not everyone's ideal, but we will try our best to get a harmonious one. And on the left side is actually a vertical line where we actually divide the face into 5. But this is not important. The most important thing is know there's a horizontal component and a vertical component. And in dentistry, we actually look at 2 things. One is the midline. It means that if I draw one line from the top of the nose to the center, the front teeth should be around there, around the center.
Okay.
All right. So if you take a ruler like that, the top.
So it should be on your front tooth, the first teeth, right?
Is my camera blur?
A little bit, yeah.
Is it better?
Yeah, it's better now. Yeah, losing its focus.
All right, let me adjust this
So no worries. Let Dr. Beh get back in
to
action.
the
I
webcam.
hope you guys are enjoying the session. I think this is such an amazing, insightful session, right, Tiffany? Is
Yeah.
Dr. Beh back?
Is it
Yeah, I
back?
think
Is
we
it
can
back?
Yeah.
see you loud and clear.
All
Yeah,
right, all right. Sorry for that.
no
Logitech,
worries.
I don't know what happened,
It
but
happens. I think no
it
problem.
happens. Technical error, right?
Yeah.
Yeah. All right. So the vertical component is actually taking a ruler or something to measure the nose here straight down, and you see whether your teeth is in the middle or not. That is called midline.
Okay.
All right. So these are vertical. The horizontal, usually we take the eyes, or even when you stand up straight on the floor, the horizontal, and you need to know our smile should be harmonious. That means it should be flat like that. And if your smile is like that, something is wrong. That's called cant. So I actually had a few patients from, not to mention names, there are some other dentists that have done braces, and they say, I do not know what's wrong with it. You know, after braces and everything, it's like something is wrong, but I do not know what is wrong. And the dentist said, your teeth is straight already. Everything is straight, is in bite, everything is okay. And sometimes some dentists or some patients as well do not realize that actually their face is not harmony. And
Oh,
actually, one person that I want to show, you all know who is this, right?
oh yes, definitely.
Tom Cruise.
That's Tom Cruise, right? Is he handsome?
Yes.
Yeah.
Of course, I think Tom Cruise has this look that even the younger generation will think that he's handsome. The older generation will think he's handsome, and that's why he's such a celebrity. But if I didn't tell you, what do you think about his smile?
It looks perfect.
He
It
looks
looks
great.
perfect.
Yeah.
Great, right? Of course, he's also a kind of a teeth model where he has,
Okay.
they call it molar to molar smile. That means when you smile, you can see all the teeth. It's like a grill,
Okay.
and yeah. So a lot of people think that his smile is actually very very nice, but you know lah, dentists we are a little bit nerdish and we like to analyze things, right? So what if I add a line to his face?
Okay.
Do you see the midline on his
Oh
teeth?
yeah, it's not in the middle, right?
It's not in the middle. It's funny that how his teeth
But
is
it doesn't look weird.
exactly. So this is what I want to teach you all. Yes, in dentistry we look at the cant, that means the horizontal line and the vertical line. But the most important part of this is that we need to make it harmonious to our face.
Yeah. Okay.
In some patients, we need to do this. Some patients you need to do that. And in
So it
Invisalign,
can't be
what we
too straight as well, too aligned as well. It's not going to make it look perfect, right?
not true. It depends on the face. So it depends on your jaw structure. So in some patients, it looks better when it's straight towards, because like for example, Tom Cruise's face, his lower jaw is actually straight to the left more. On the screen is to the right. So it's straight to one side, right?
Okay. Yeah.
So when it's going towards that, we have something called facial flow, where it comes like that and it sways like that. When it sways like that, your teeth should sway that side also. Then it look more harmonious. So in Invisalign, just now I show you all the picture before and after, right? You can actually see the patient's face before and after for the treatment. That's the beauty of it. And in Invisalign, we try to manage that by using this one. And so when you see yourself, first, one is E line, right? Secondly, plus is the horizontal and vertical
Horizontal and
component.
vertical lines. Yeah. Okay.
So the vertical line is to do with the midline. Not everyone is definitely straight, but we will try our best to follow the facial flow. Right? The horizontal line is to see your smile, whether is it balanced, is it slanted or flat. And if you see Tom Cruise one also, actually his one is slightly tilted one side higher a little.
Yeah,
That's
a little bit. Yeah. Now that you brought it up, it's quite obvious.
yeah. So I want to say that no one is perfect, but it's in the imperfection that
That we find perfection.
we find perfection. That's true. Yeah.
Tiffany,
So just
there's a question for you actually. This someone June on said, asked, Tiffany, can you share how was your whole experience on wearing this? I'm sure your personal insight would be helpful. I'm curious, does it look bad in photos? Drinking with a straw, does it affect? How was your experience like? Yeah.
Mhm.
So basically, as I mentioned, right, I didn't really experience that much of a discomfort. It's more of like a tightness, soreness, and compared to my friends who use traditional braces, they cannot like eat normal food or even like just rice. They feel pain, for 2 weeks. But for me, like for the first tray, right, I could eat straight away, like the frozen dark chocolate from the fridge. I didn't have any problems with that. And basically, I'm wearing my trace right now. So I'm pretty sure that you guys can't see it, right? So it
Oh,
doesn't
definitely
appear.
not.
Yeah, I cannot see, right? So
Yeah.
it doesn't appear in photos, and like even in real life, people don't even know that I'm using, like I'm correcting my teeth, basically.
So do you go out with
So
it wearing your aligners?
yeah, you certainly have to, because it's a rule kind of that you have to wear it for 22 hours a day. So your compliance is very important, like Dr. Bay has mentioned. So, but we have this pouch, so then it's easy. So when you carry it out, you have like a little kind of container that you can put your aligners inside. So it's very portable. Like you can put in your pocket, your bag.
Like when
It's
you want to
easy.
eat, right? So you have to remove
Yeah,
it when
yeah.
you
So
have
just
to
don't
eat.
grab it with tissue, because sometimes people, the waiter and waitress, they will throw them away. So yeah, and drinking with straw, it doesn't really affect, because there's a rule that you have to remove it if you're drinking, with straw or without straw, as in drinking anything other than water, because it will stain your
Same,
trays.
especially when you drink coffee and tea,
Yeah,
right?
yeah, yeah. And
Okay.
when you're eating curry and stuff like that, I have to remove it. Yeah.
Yeah. So I hope June on. So I hope that helped you get your answer for your question. And I
Let me a
think Dr.
while.
Wei, yeah.
Let me remove my camera. Let me adjust my camera. You'll continue talking first.
Yeah. Okay. So maybe you can just see any other questions. Okay. And how about eating French fries and when eating burger? And is the salivating really heavy? Do you have problem with your salivating during? I mean,
I
during
don't really have
wearing
any
the procedure?
problems with saliva, like, but it's a rule, right? Like, whatever you eat, you have to remove it, because
Remove
you
it.
don't.
Yeah. So it doesn't matter
Yeah,
is your burger, your fries, June.
yeah.
So we gotta remove it as you eat.
Yep. So you can only drink normal room temperature water, or cold water is okay. Don't drink anything hot with it.
Hot water.
Yeah.
Okay.
Otherwise, everything else, just remove it. And it's actually not that difficult. Actually, I treat so many patients so well that I have no choice but to treat myself as well. I'm a perfectionist and I want things to be right. So this is a liner, and it's very, very easy. Just to pop it on, I'll just show it in front of everyone. That's all.
Okay. Yeah. That's all.
2 seconds.
And removing is as simple as that as well.
Removing is as simple. Of course, I don't want to show everyone.
Okay. Yeah.
That's all.
Oh wow. Okay.
One,
That's really simple. Yeah.
done. It's 3 seconds, and it's not that troublesome. I can, as Tiffany said, she's talking with it. She can speak anything. And if you have an important event, like I am having a very important event now with all of you all here as in the audience as well, Navinder and Tiffany, sometimes I can actually take them out for a short period of time during this talk show, and later on I can step it back on
Just
any
put it
time.
back. Yeah. I think it's very
Yeah.
convenient compared to braces because you can just put it and remove it whenever you have a special occasion. Yeah.
Yeah, and you don't have to with braces, right? What happens when you eat certain things is that it gets trapped onto your braces, and then you probably need
Yes.
to like
Clean it
take it out or
out. And
something. Yeah, yeah.
a lot of
So
hassle.
Invisalign, you don't have this issue. All you need to do is probably rinse your mouth or drink some water and rinse and gargle, and then you can put it on, step it on after that, no problem.
Amazing. Okay.
Yeah. All right. So 1 plus 1. So the 1, what is 1? You remember, everyone?
Fine.
The E line.
E line. All right. And the plus is
The
the horizontal and the vertical line. All right, and so I want to show you. It's not so easy for being a dentist. You know, every case is very different, and I want to show you this crazy case that was rejected by many dentists. And he was supposed to go for surgery. All right, and it's not wisdom tooth surgery. You know, it's to remove her upper jaw and break her lower jaw, and we call it bi-jaw surgery. That means break her upper jaw, lower jaw, put it into bite, and then only join it up together again. And I want to show you this case.
Sound is
Yeah,
a little bit.
I don't know where the sound come from.
Yeah, there's some echo coming, Dr. Beh.
Is it from me?
Maybe we can. Is there another device near your place, your table?
Nope, I removed my.
Yeah, I think.
Oh,
Is it
she's
her?
gone.
Is it her device?
I think it's her device.
Yeah.
We missed you. But we shall continue with this case first because this case is such an interesting case. All right. So just now I have technical problem. Now she has technical problem.
I wish I don't have technical problems.
Because your problem has been solved with Invisalign.
Yeah. The power of Invisalign.
Power of Invisalign. And in this patient as well, she was supposed to go for bi-jaw surgery. Basically, hello.
Hi,
Welcome
hi,
back.
Yeah, okay. So yeah, I had some technical
Please.
issues as well, I think.
You should
we
use
just-
Invisalign.
You should use Invisalign to correct their problems.
Okay. Yeah.
All right, back to this case.
Mhm.
So this case is a very interesting case because this patient went to multiple dentists, specialists, senior dentists, and all whatnot. And all of them said that she must go through surgery to break her upper jaw. It's a major surgery that they cut your upper jaw below your nose, break the upper jaw, and the lower jaw cut at the back so that they can reposition it in the right position, then finish it with braces.
Okay.
And once more, I will talk up the challenge. She came to me and I said, give me some time and I will plan for you. So what I did was moving the teeth backwards and inwards, and voila,
Wow.
that's what you want to achieve. And that's how Invisalign has this. And braces, I have no confidence at all. I would say it's almost impossible to do such, not
With the
impossible. Some doctors might be able to do so, but I would think so that this Invisalign case that I've done is one of ideal. So for example, like this, what I do is I move the back teeth backwards. Braces doesn't do that unless you put screws at the back and pull it in. This one, it actually push it backwards and upwards. And if you are very, very technical, you actually move the teeth one by one inwards. It's not all pushed together. It's one tooth first, then the next tooth, then the next tooth at the back. And then it moves backwards, and then the front tooth simultaneously come down to like this. And guess again, how long does it take to achieve this?
Yeah, how long does this take? This looks a bit of a severe case, right?
This is a very severe case. I would say that time when I did it, I don't remember. I think I did this case 4 or 5 years ago. And this is one of the most complex cases that time.
And how long did it take you to solve this case?
So
Dr.
if you
Beh?
can see the number below there, it's 53 weeks.
Wow, okay.
So it's
But I
little
think, yeah,
a little short than a year.
that's very reasonable. I mean, like, it's not even a year. That's so fast.
Yep. And this is, for me, the treatment of choice. As in, like, she's supposed to go for surgery, a very major one a bit. And we are able to just use Invisalign alone. No screws, no nothing. Just moving it backwards like this and forward. And I have
So
the
does
after
this
picture.
result stays forever?
Yes, if she maintains the tongue position that I taught her, because one of the reasons of why she has open bite is because of a tongue muscle, where she pushes forward when she swallow.
Okay.
So I corrected the tongue muscle, I corrected her bite, I teach her some clenching exercises. And with all this in combination, I'm able to use Invisalign with face standard concept to move the teeth inwards and downwards like that. And after 1 year, let me show you the second scan. The second scan, yeah. This is what we get, literally. So if you realize the midline is not exactly on point, but this is the result after 1 year. The real scan. Yeah,
compared to how she was, this looks so much nicer.
Compared to how she was, this is almost impossible case, that one. But I'm a bit of a perfectionist, as I said.
The legend.
You see, the second tooth here and the second tooth here is slightly smaller, if you realize. It's like not proportionate.
Okay,
that means her natural size teeth, a natural teeth size is not proportionate. So what I did was I actually opened up the space with Invisalign by moving the teeth backwards and whatnot, and open up a space between here, front and back, like this. It's intentional. So this is planning so that I can get a better midline, and on these two teeth, I'm able to put on veneers, something to stick in between to make these two teeth bigger. As simple as that.
Okay.
Yeah.
So how do you create a space between the teeth though?
Yeah. With Invisalign, I'm able to move the teeth, right? So I'm able to move the teeth backwards. You can see I move the teeth backwards, and then I created space. And in that sense also, yeah, and I'm able to actually, if you see this bite, let me enlarge it a little. You can see the bite is not complete, as in like you can see a lot of gaps in between, right?
Yes.
With Invisalign again, I want to get a better bite, so I move it backward more, and I'm able to get a much better bite. It's like everything falls into place even better with this on both sides. So this is one of my crown jewel case again. Very, very difficult case, but we are able to achieve it with Invisalign. We call it infantile open bite. It means, but this patient initially came with only being able to bite on the last tooth. All her teeth cannot bite, only biting on the last teeth. And we are able to achieve that in a pretty fast time. Of course, after that, there was some complication like that the center tooth, these two small teeth is too small, and we wanted it to be better. So we just redo again. So we scan again, we redo. And in our package, so we will help you to redo at least once. We call it refinement, and that's free of charge. Replan everything. So you have at least you have a warranty, and you know that no worries, I'll be taken care of. And a doctor needs to go through with you to make sure that he or she finishes the treatment total in until the end. Yeah.
So if you guys are interested, so make sure you check out the link for tele consultation with Dr. Beh. Also, to get to know more about the packages of the treatments, you can check out the link below.
Yep.
And yeah, so we have our giveaway quiz right now.
No, haven't. Later, just
yet?
reminder.
Oh, just a reminder.
So,
okay.
Yeah, reminder. So stay tuned to the end. Only at the end we will have the.
Yes.
Yeah.
So we'll give away 3 free teleconsultation with Dr. Beh at the end. So make sure you pay attention further. Yeah.
Yeah. Okay. So the 1+1 diagnosis, we have done the 1, we have done the plus, we have the last one, and this one is not so difficult. The first one is very easy, right? The second one is a bit more complicated.
Okay.
The third one is also easy. All right. So there's a lot of aesthetic principles lah. But I only focus on the first one, which is the incisor display. So in these 3 pictures, who do you think is the youngest and who do you think is the oldest?
I think the youngest, maybe the one in the middle.
Okay.
The oldest in the right.
Yeah, the right would be the oldest, the utmost right.
Mm-hmm.
Is that
and
right?
why do you think so?
Actually,
don't look at the skin. Yeah, don't look at the skin structure. Look at the teeth. We are talking about teeth right now, so dental. So this is actually a research base that they find that when your teeth when you're younger, you generally show more teeth. when you are older, our lips actually gets relaxed and weakened, and that's why our you show less teeth. So in younger patients, right, usually you'll be able to show more teeth on the upper. And there's two positions. One is the upper pictures are the smiling position. That means when you smile, that's how you look. The lower is called the resting position. That means you are blur, like that. That is the resting position. All right. So by right, this one, the 1+1, the last one is first tooth. What we are looking at is, I call the front tooth. So when you are blur like that, you should be able to see your teeth a little. And for girls, it's slightly more. It should be around 2 to 4 mm. Guys, lesser a little bit, 2 to 3 mm is okay. But girls, slightly more is a little bit sexier. So when you imagine when you are just blur like that, and if your lips cover your whole upper lips, you actually look older, and or you look like you don't have teeth. It's like
you don't have teeth.
yes. So make sure. I have some patients that have done orthodontics before, and what they did was they go through Invisalign again to lengthen. If certain case, we are able to push the upper teeth downwards a little and give it this front look. That means when you are resting position, you should be able to see your front tooth a little. Just expose a little bit. So for younger patients, I would go a little bit more. And for older patients, if they want to look younger, I will go a bit more also. Right. Of course, no one wants to look old, right?
Yeah.
I don't think so. I have not encountered, probably some people want to look old, but most patients wants to look a tad younger. A tad younger. Yeah, so Invisalign is one of the way to diagnose yourself. One is the facial, the E-line. Secondly, is the horizontal and vertical line. The third one is the front tooth, where is the front teeth.
Yeah, the front tooth.
Yeah, the front tooth. So 1+1 diagnosis. So you at least, I think with these 3 simple guidelines, I think most of you can understand how your teeth affects your face.
I'm very sure you guys are, getting some insightful. Okay. So let's just check if we have any more questions. Okay, so there's another question.
Yep.
Wouldn't it traumatize the gums? Invisalign.
So Invisalign, compared to other aligners, clear aligners is a type of orthodontic devices, and Invisalign is one of those they use a laser cut technology where, let's say for example, your teeth is here and your gums is on top here. They use a laser cut where they cut your aligners exactly at your gum line, and it's usually 1 mm away from the gum line. So usually it doesn't touch your gums. Sometimes our gums grow. If it grows, what we do, we need to do some adjustments to our aligner. Just cut it off a little, trim it a little. But usually it shouldn't be damaging to your gums. In fact, if you have gum problem, and you really need to arrange your teeth orthodontic treatment, I would recommend Invisalign over braces, because Invisalign is way more gentle and I can plan the movement slower compared to braces. And of course, you also can keep cleaner compared to braces. So if you have gum problem, if you really need to do it, I will always advise Invisalign over braces.
And there's another question, Dr. Beh. How does Invisalign pull teeth downward, and what can be done for middle alignment?
Middle alignment. I don't understand that question, but to move the teeth, let's say for example, let me take a shot. So let's say this is your tooth, right? We're gonna move it lower. So what the Invisalign do is that there's a plastic that holds onto the teeth, and it will slowly hold down the teeth. But just now you see on the clean check as well, you see some pink things on the teeth, right? Those are called attachments. And attachments is help for the aligner to get onto the tooth so that you'll be able to bring the tooth down. So let's say, for example, just on a case where it's upper one and you want to bring the tooth lower, that you can use Invisalign with an attachment on it, and then Invisalign will be able to hold the tooth and pull it down.
Okay, I hope that answered your question. Okay, Dr.
Yep.
Beh, we are almost done. Maybe
Yep.
we should conduct the questionnaire for the giveaway.
Yep.
So do you have your
So-
questions prepared? So
Yep.
guys, be ready. There will be a giveaway soon. So make sure you answer the questions on the comment section below, and we will be announcing the winner later on Dr. On Call page. So let's conduct the questionnaire.
Yep. So if any of y'all are interested in Invisalign, you can comment or you can click on the link to enter Dr. On Call's website
Yeah,
or our
correct.
Facebook of Invisalign. So let's
Yes.
go for quiz time.
Yes, it's quiz time. Are you guys ready?
Okay. So the trick is to write the most accurate answer, not the fastest. The most accurate answer at the same time the fastest. So
The fastest
Dr.
and most accurate answers will be
Yeah.
the priority.
Selected.
All right.
And the judge will not be me, it will be by Dr. On Call. The team will judge according to my presentation. And of course, have to cross-check by me to make sure that's accurate, right? And then they will award the free consultation to the 3 lucky winners. So it's actually very, very simple. It's actually, if you have heard me from the beginning of the sharing to the end of the sharing, what is the one in self-diagnosis?
Okay, the first question, I'll just repeat again. So what is the one in self-diagnosis? So come on,
Yep.
guys, put your answers below and we will be evaluating your answers. The
All right.
fastest and the most accurate answer will be prioritized. Okay, let's go for a second question, Dr. Beh.
All right. And of course, answered by it, not so easy answer, it would be the plus. What is the plus?
All right. So the
plus,
second question
yes.
will be, what is the plus sign in the
Mhm.
self-diagnosis?
Yep.
Come on,
That's
guys.
correct.
Let's be fast so that you win your free teleconsultation
Yep.
with Dr. Beh.
Just an insight, if you're a clinic and you come for me for consultation, I do a full consultation for Invisalign, usually costs around 350. And then I usually do a facial consultation with facial concept. Then I will charge another 150 on top of it. So there'll be around 500 worth
Wow.
of.
So that's the giveaway is about 500 ringgit. So guys, come on.
Yeah.
Second question. I hope you guys have already put down your answers. Should we go for the third
Yep.
question, Dr. Beh?
You also
What
can
do you give them?
elaborate more. So those we will see those who also explain about it. What is one and what is it about E-line? Then okay, I see sorry, I said the answer, but what is it, and elaborate a little bit on what is horizontal, one is vertical, and the last one is of course what is the one. So
And what is
1
the
plus
other
1, yes,
in
1 plus
self-diagnosis?
1, and this is what is the last final one.
Okay, guys, so I can see some of them have already answering, and yeah, so
Yeah.
your answers will be evaluated for by Dr. On Call, so they will let you guys know if you have win this questionnaire and giveaway
Yeah.
session with Dr. Beh. So keep going and keep answering. We might just pick the right one and the one who is the fastest. So yeah,
Okay,
is
I
that
would
all
like to
for
answer.
the quiz?
Yep,
You
that's
want to
all for the
answer
quiz.
questions? Okay.
Yeah, I want to answer some question. So just now it says that I think I understand what he meant by what can be done for midline alignment. That means just now we talked about, let's say the face, the teeth is one-sided. So just like the case just now I showed, we can actually move the teeth backwards one by one and slowly move the jaw towards one side to get the midline. Not all the time I'm able to achieve full midline. Depends on patient. So if in like Tom Cruise like that, he looks good with it slightly slanted. In fact, if you straighten too much, you will see that the whole jaw is slanted, right? So if we will try our best to get a harmonious midline by moving the teeth around. Yep.
So what Dr. Beh will do is basically fit the best for your face, and
Yeah.
you look the best. That's what we want. We don't want to look funny after alignment, right? Yeah. Okay, so I think there are a lot of answers already, and Dr. On Call will pick the right answer.
Yeah.
And you guys should be waiting for your winner announcement that they will definitely personally let you guys know. And I think we had such an insightful topic today, and we discussed so many things about aligners and how to diagnose yourself, especially at home. And it was such an amazing session with you both, Dr. Beh and Tiffany. I think we should wrap up our session right now, and we will definitely wait for the next session, maybe sometime soon, and we'll announce it on Dr. On Call page. So thank you guys for joining our session today, and thank you so much, Dr. Beh, once again. Thank you, Tiffany, and I'll see you guys soon. Take care, stay safe.
Thank you, everyone. Stay safe.
Thank you. Bye-bye.
All right. Stay pretty. Say bye-bye.
In Doctor on Call, we believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Doctor On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management, where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online, so the patient can get treated a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Dr. On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, once just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy.